Hey everyone, it's Dr. J again, and let's talk T. And when I say let's talk T, I'm talking about testosterone, of course. But before we dive right into the testosterone things, today we're going to talk a bit about optimal testosterone levels for peak performance and for vitality and all those other things that testosterone is really important for that we've talked about in all our other videos up until now. But to kind of get into that topic, I think it's really important for us to recognize that there's an issue that kind of goes well beyond testosterone here when it comes to testing. And we've talked about how total testosterone is not a really relevant test at all and how it's kind of dumb on its own. Certainly it's useless on its own. But when it comes to lab testing and when it comes to just our perception around what is normal. And so I think I've done other videos or talked about this before, but I really want to emphasize in this video here, as we're talking about testosterone, that what is normal or what is common does not necessarily equal optimal. And so just because your blood levels are within a normal range, an expected range, a typical range, an average range for your age even, that doesn't necessarily mean that that is the adequate or the optimal amount for you to be at your best. And that's a big difference between when we're looking at things from a conventional medical standpoint and in the conventional medical system, we're worried about things being really acutely wrong, things that we can do immediately to save people's lives or to alter their states in a very short period of time. But when we are, as a group, people who are watching this video, probably you, when we're thinking about optimizing and getting over some of those sort of issues that are bugging us or that we're starting to see begin to plague us, but we haven't necessarily been diagnosed with a major problem yet. I work with a lot of people who are mostly healthy, but not necessarily at their best. And we're just trying to be as awesome as possible. So for those of you who are thinking about optimization, who are thinking about future health span, as opposed to just longevity and lifespan, but health span being as optimal as we can and functionally optimal for as long as we possibly can, it's really important that we shift our thought process from, am I within the normal limits, or am I experiencing what the average person might be expecting, or am I at the peak of my game? Am I at the top of my abilities and maximizing my potential? Am I optimized? And that's what we're getting into. So as we get into optimal lab ranges, specifically for testosterone and the related blood tests that we need to be thinking about around testosterone, keep in mind that testing for these measures needs to be done correctly. Testosterone levels fluctuate throughout the day, for instance, and there are other factors that we have to consider before you go for your blood test. So stay tuned for those tips and tricks after we talk about the optimal ranges for testosterone and free testosterone and bioavailable testosterone, sex hormone binding globulin or SHBG, and that free to total testosterone ratio. We're going to talk about optimal ranges for all of those things right now. So let's jump right into things, and then we'll get at some of those tips and tricks for actually doing the test so that you're getting good data. For most adult men, let's start with total testosterone. For most adult men, total testosterone should generally be between 300 to 1,000 nanograms per deciliter. If we're using our standard units, then 10.4 to 34.7 or so is our nanomoles per liter measure. But as we've discussed before, total testosterone is kind of a useless test without knowing what your sex hormone binding globulin levels are. And ideally, we should be looking at your bioavailable testosterone and or your free testosterone levels along the way, and then calculating your free to total testosterone ratio. Again, we've talked about that in another video. We'll come back to those optimal levels in a second. But the bottom line here is total testosterone is kind of irrelevant. It should be noted that total testosterone doesn't decline that much over time as we age. And that's a common thought process. Like you hear that all the time. Testosterone levels decline as you get older. Once you're 25 years old, 25 to 28 years old is kind of our peak for men as far as our testosterone production. And it kind of falls off a cliff slowly over time. Well, it's not total testosterone that's actually the issue. It's generally that sex hormone binding globulin is increasing, rendering more of that total testosterone useless. And therefore, it's even more important for us to know what those bioavailable scores are and what your free testosterone levels are as we move forward into our older ages and as we age in general, really after our 25 to 30 year old age range. So that's total testosterone, 300 to 1,000 nanograms per milliliter. milligrams per deciliter, or 10.4 to about 35 nanomoles per liter. That's sort of what we expect. And it doesn't really matter what that number is as long as it's kind of within that range. Total testosterone really tells me, are you hypogonadic or are you experiencing symptoms that might be associated with testicular cancer? That's kind of all it rules in or rules out. It's kind of useless on its own without knowing these other tests. Sex hormone binding globulin, or SHBG, should generally be less than about 35 nanomoles per liter. That's pretty ideal until you are into your later years, around 70 years old or so. I'd suggest that we should really try to be keeping those numbers down under an increasing range, which starts to curve upwards at about 65 or 70 years old. So at that point, under 50 nanomoles per liter, around 65 years old, under about 55 nanomoles per liter at around 70 years old. And if we're entering our 80s and 90s, it's probably trying to keep it under 60 nanomoles a liter or lower. But generally speaking, the lower the sex hormone binding globulin, the higher your free testosterone and total testosterone and your ratio of free to total testosterone ratio, and the higher your bioavailable testosterone. So that's probably the most important factor here. SHBG is just as much as a factor in your bioavailable or free testosterone as your total testosterone. Their total testosterone is important. SHBG is important on their own, but together they are what give us our free testosterone and then bioavailable testosterone as well. SHBG is a really important topic, and I'm going to have to go into more detail about SHBG and how to modulate SHBG into optimal ranges in a future video. So make sure you hit the subscribe button to be notified when that one comes out, especially. Jumping onto free testosterone, and as much as I like to see free testosterone levels when it comes to blood work, I actually quite prefer bioavailable testosterone and evaluating the free to total testosterone ratio. The free testosterone levels maybe not quite as important to me, although it's still much more appropriate for evaluating testosterone insufficiencies than total testosterone on its own. But the flip side of that argument is that I would argue that there's probably more data to back free testosterone optimal ranges compared to total testosterone and especially bioavailable testosterone, which I would argue we don't have a lot of great data for in terms of ranges. And that's actually why it's taken me so long to do a video like this, is because for years, I'm in my 15th year of practice at this point, and it's been something that I've really struggled with is, what is optimal bioavailable testosterone? Because we don't have anyone really dictating or telling us like this is the normal range or this is the optimal range for that matter for bioavailable testosterone. But I feel like over the last 15 years, we're now at a point where I certainly feel comfortable kind of giving some specific numbers or targets for where ideally at each sort of age, at every age, approximately where our bioavailable testosterone should be striven for. That's kind of where we'll get to. But before that, free testosterone. Typically, we want to expect ranges for free testosterone to be between 35 and 155. That's picograms per milliliter. That's equivalent to about 120 to 540-ish picomoles per liter. So again, just watch your units on that one. Free testosterone is much lower in quantity than our total testosterone and our SHBG, et cetera. So we typically measure that in much smaller units. So, and then when you're doing your ratios, you've got to start converting. I would suggest that targeting over about 300 picomoles per liter, those are the SI units, that's what we use here in Canada. That's what's optimal for most of our age ranges, so over 300. There are different expected ranges for younger men versus older men, and it does kind of decline over the years. But to keep things simple, for most men that are probably looking at this video and watching this video between the ages of 25 to 45 to 55 even, over 300 picomoles per liter is probably what we should be targeting. So the upper third of the normal range, that's what we want to target, and then ideally higher to optimize even further. In my practice though, especially when free testosterone is kind of in a reasonable range within that limit of 120 to 540 or so, I like to look at the ratio of free to total testosterone as an even more important number. And so the free to total testosterone ratio that's optimal is 2.5%, 2.5%. That's kind of our target. I've seen some and spoken to some practitioners who would recommend as high as 3%, but over 2.5%, and that window being 2.5 to 3.0% is our target for our free to total testosterone. Usually because your free and total testosterone levels are going to be reported in different units, you're probably going to need to convert one of those units to match the other. It's probably going to be you converting free testosterone units into total testosterone units. And you can use online calculators to do that. Just do a quick web search and you'll find several online calculators or converters that can help you do that. So that's readily available to you, of course, as well. Lastly, let's talk about bioavailable testosterone. Bioavailable testosterone definitely does decline with age. At 25 years old, this should be your peak as a male, 25 to 28 years old. Statistically speaking, hormonally speaking, that's when we're at our peak for testosterone levels. So I like to see the young men that I work with in my clinic be up and over around 12 nanomoles per liter for bioavailable testosterone. At 30 years old, we're looking at anything above 11 nanomoles per liter being pretty awesome, and that being an excellent target. At 35 years old, we should be looking at least 10 nanomoles per liter. At 40, about 9 nanomoles per liter, and so on. We can kind of assume a reasonably linear decline here for bioavailable testosterone. So at 45, it's about 8 nanomoles per liter. And that's okay at 45 years old, but it certainly leaves room for improvement, at least in my opinion. And personally, as I approach my mid-40s, my personal goal is sustaining my bioavailable testosterone levels over 10. That's sort of the ongoing goal for me. So now we've talked about bioavailable testosterone, we've talked about free testosterone, we've talked about sex hormone binding globulin, and of course we talked a little bit about the total testosterone ranges that we might see out there. Important for you guys to make sure that you're watching your units. I'm going to make sure that the units and the numbers that I've talked about today in this video are imprinted on our video, so you'll have those and you can pause the video and make sure that you're getting those numbers written down if you need to. But before we go any further, or before we end this video, laboratory testing is a tool, which means the data is only as good as the tool is used properly. Improper testing is going to give you shitty or inconsistent numbers. So for that reason, it's going to be really important in the case of testosterone that we are consistent with how we test testosterone and the related measures. So I guess, first of all, after your baseline test, you get your testosterone levels tested, hopefully bioavailable, not just total. And you've initiated some sort of protocol or program to optimize testosterone. We'll get into that in other videos. But once you've established your baseline, you probably want to test every 3 months or so for the first year. And that's just to ensure that progress is being had and you're moving in the right direction. There's probably a little bit of tweaking or streamlining of your protocol as the first few months go along. So you want to make sure that every little tweak that you're making is the right decision. And that's why we test a little bit more frequently. After that, though, it's probably more like every 6 to 12 months that you need to be measuring progress to make sure you're keeping on track. And it's also an opportunity and a reminder to make sure you're seeing your licensed and experienced healthcare practitioner to make sure you're being evaluated and monitored, because there are side effects and negative effects that can happen, whether we're doing things more naturally or whether we're talking about TRT or HCG for that matter. If we're raising testosterone levels especially, then that's something that we need to be mindful of in terms of how it can affect other systems in our body, particularly around cardiovascular disease, risk, heart attacks, and strokes. Another factor, though, is that testosterone levels fluctuate throughout the day. Testing testosterone really should be done within 2 or 3 hours of waking and having fasted overnight for at least 8 hours, probably ideally 10. And that's because testosterone is produced in its greatest quantities in the middle of our deep sleep. Deep sleep is when we produce most of our testosterone and growth hormone for that matter as well. Now, there is some data to suggest that as we age, that release of testosterone, it kind of evens out throughout the day. So for young men, that's certainly the case where we definitely want to be testing first thing in the morning. You could make an argument for as we age and as we get into our 50s and 60s and 70s, maybe it's not as necessary to be fasted overnight and to go first thing in the morning for that blood test. But I still recommend personally in my clinic, no matter what age you are, that we go first thing in the morning after having fasted overnight. Usually we're running other blood work alongside that testosterone as well, things like cholesterol levels, fasting glucose and insulin levels. So those are tests that need to be fasted for anyways and done first thing in the morning. So we may as well. So that's a big one for me. So these are things that we need to think about when it comes to when we test and how we test. And then lastly, we should definitely not be testing testosterone when we are sick or when we're under very high stress. As a very small piece of the explanation here, one of the things that happens when we are sick or when we're under higher stress is that we may be producing higher levels of another protein called corticosteroid binding globulin. So it's very similar to sex hormone binding globulin. And corticosteroid binding globulin, or CBG, generally is going to bind our corticosteroids, cortisol in particular. That's, again, a whole nother ballpark for another video in terms of the implications for burnout and mental health and for brain function and body function and optimizing performance. But CBG also will bind lightly, not as strong as sex hormone binding globulin, but we will also bind some testosterone with that too. So that's just going to increase the binding effect on testosterone and showing even lower levels than we might actually be having. So if your blood levels are low in another protein which binds testosterone, that's called albumin, your calculated BAT or bioavailable testosterone and your free testosterone levels might not be accurate. So this is a big reason why adequate protein and adequate caloric intake are so important when it comes to testosterone management, and why we get really funky results sometimes in really underweight or anorexic patients, or just people with deficient diets, especially those that are deficient in protein or in calorie deficient diets. And that can happen even in very active people. So people who are going to the gym regularly and trying to be as health focused as possible, but they're actually going too far in terms of the restriction of calories. That can happen as well, and that can be a stress on the system, and that can also affect your albumin levels, in turn messing with your test results when it comes to testosterone. Okay, so now you know what optimal testosterone levels are, and more importantly, I hope that you're getting that total testosterone is totally irrelevant without knowing your sex hormone binding globulin levels, and ideally seeing your bioavailable and free testosterone levels, and ideally looking at that free to total testosterone level as well, or making that calculation. So just as important, you know now how to use testosterone testing appropriately. You know when to test, how frequently to test and to monitor your levels, and when the tool might not be the most accurate. Hopefully you have already got your testosterone levels checked at this point, or if you are curious about that or you think there might be something going on, really important that all of you speak to your licensed and experienced healthcare practitioners before you're making any changes to your healthcare regimens. And of course, they can help to facilitate these kinds of blood tests so that you can get the best data that you can possibly get to make the best decisions about your health for the immediate future and for your future health span as well. That's all you need to know for now, but we are going to be getting into how do we boost total testosterone? How do we increase testosterone naturally? How do we decrease sex hormone binding globulin so we can increase that free to total testosterone ratio? Those are the videos that are here to come. So if you want to be notified when those videos get released, please smash that subscribe button right now. But otherwise, I hope that you guys got something out of this video and that it's helped you in managing and taking better perspective on your health and your testosterone levels. My name's Dr. J. I'm here. If you have any questions or concerns, fire them into the comments and let's get talking about them. But I'll see you guys in future videos. For now, hope you guys are staying awesome. I'm Dr. J. Talk to you soon.